And I now run the NHS Institute for Innovation and Improvement, which is a body that tries to help the NHS in England to innovate. And the NHS is improving on all sorts of measures in terms of mortality, in terms of access to A&E and GP outpatients, etc. In terms of improved patient satisfaction on all the objective measures, the NHS is improving, and it bears comparisons with most other health systems in the world. This particular analysis, which was carried out by the Commonwealth Fund in this particular instance 3 years ago, found the NHS as the strongest of the healthcare systems of these 6 countries. There's a new version of this due out in about three weeks' time that will have 13 countries. The previews are that the NHS again will come out as a very strong performer. And on issues facing Britain, the things that people are concerned about in the public sector, you can see that the NHS has fallen quite substantially in the public sectors, in the public's concerns about things facing Britain. But nonetheless, despite all of that, we need to improve a lot more because there's very, very wide variation in clinical practice in the NHS. There's evidence that care isn't as safe as it could and should be. The costs of care are rising in a manner which is unsustainable. And whilst the NHS is a protected department, nonetheless, we know that we'll get a fraction of the growth in the period that's coming than we've enjoyed in healthcare in the past few years. And we also know that for many of you, your experience of using the NHS is still not remotely satisfactory. Just to give you a couple of examples here, this graph shows mortality rates amenable to healthcare. And whilst on the first table I showed you, the NHS came out very well, on this particular graph you can see that we're a poor performing country in terms of avoiding mortality amenable to healthcare. And this graph shows every hospital in England. It shows the percentage of patients admitted for surgery, routine surgery, who come in on the day of the operation. It shows that there's enormous variation. If people could move to the performance of just the median performance, we'd save 400,000 bed days or £80 million. And there are many, many other examples where the NHS's performance varies extremely substantially. As I've said, we've had a period of extraordinary growth in funding in the NHS, as have most other healthcare systems in the last few years, as you can see both here in absolute terms and as a proportion of GDP. But during that period, we've had pretty flat productivity according to the Office for National Statistics. It's actually very hard to put values on the outputs of healthcare because if you think about it for a while, just treating more people is not a very good measure of the effectiveness of healthcare. And putting a value on improvements in quality, on faster access to services is quite difficult to do. But nonetheless, the ONS's best estimate of this shows a service that during that period of great increase in financial inputs has also seen substantial increases in cost and productivity pretty flat. So, the other thing to think about is that you might think of the NHS as a whale, and Alison was talking about the HMRC having an enterprise-wide approach. Actually, the NHS isn't a whale, it's a shoal of fish that sometimes swims in the shape of a whale. There are lots and lots and lots of different organisations within the NHS. There are 8,300 practices, general practices. There are more than 300 hospitals. There are thousands of places where healthcare is delivered. And they already, even prior to the changes coming in from the new government, all operate with a fair degree of autonomy. Can the NHS transform? Well, the summary of the evidence is we've got really good evidence that quality can improve, some of it at great scale and pace, but much more limited evidence that this also results in the release of resources. And sometimes the scale and pace has been associated with significant unintended consequences that have been negative. This is every A&E department in the country, and its waiting times. And over only a 6-month period, there was a dramatic improvement in waiting times in A&E departments across the country. That happened because there was a national target that had to be met. But unfortunately, it happened in such a way that some of the care delivered for patients was about hitting the target and not really hitting the point. On the other hand, this is a better example. Caesarean section rates here, improving in nearly all of this group of hospitals that worked together with us over a period of time. And in only 9 months, substantial improvements in what's been a very intractable measure. Hospitals will work together. This example shows in 1 year substantial improvements in mortality in a hospital through real attention, using lean-type principles to delivering certain important clinical processes in a much more reliable way. And in turning to cost and quality, we've got substantial now experience of improving quality whilst reducing cost. In the Institute, we've taken 3 complementary approaches, and I'm going to focus mostly on one of those that's very much inspired by the lean thinking approach. So we've tried to increase the visibility of the opportunities for improving productivity by using a national benchmarking system. Controversially, publicly available, for every organisation, every quarter, their opportunity against 15 measures turned into a financial productivity opportunity if they could move to best quartile performance. We've found, if I can get this to work, the very best way that hospitals do the commonest things. We've seen how that compares to poor performers, and we've been able to codify that in the example like the one I've showed you on caesarean section. And we can show that groups of hospitals working together over a very short period of time can adopt these great practices and substantially improve the quality and the cost of care. But finally, and most of the focus of what I'm going to say in my last few minutes, we've introduced programs to help frontline staff in the NHS to see and eradicate waste. So, the productive series, as we call it, releasing time to care, the productive ward. We've put into the hands of people responsible for key clinical areas like a ward or an operating theatre or a community team, a series of tools that are inspired by Lean and Six Sigma to help them identify waste and reorganise their service in a way that improves quality and reduces cost. These were co-designed, these approaches, with frontline clinicians, using principles very much based on those that the Design Council colleague was talking about earlier. And what we know is that, for example, in the ward, when we analyse the way that time's spent, it may shock you, those of you who aren't clinical staff, to know that only 25% of a nurse's time typically is spent in direct clinical care. And that it's possible for those staff themselves to reorganise care in ways which look at more effective ways of carrying out the processes of the routine on the ward in a way that releases time, so that typically after these approaches have been used over a 6-month period, the amount of time spent in direct patient care increases to typically 45 to 50% of time. And if that time is then reinvested in the right clinical interventions, length of stay falls, quality of care improves, patients are monitored in a more effective way, and it's those changes that generate the productivity improvement. And we've now been able to take this approach and use it in the ward, in the operating theatre, in mental health wards, maternity units, and across the NHS. So you get the gist of this approach, and characteristically people often say to me, well, those seem very, very simple changes, and they are very, very simple changes. And you might wonder why those changes hadn't taken place before. But they hadn't taken place before because workaround accretes on workaround, and unless people have a framework with which to step back and to look at their work in an objective way, these things don't change.